All right, ready? Okay. Thank you,
Welcome.
Mr. Chair. Colleagues, today I'm presenting AB 2540, the Community College Student Right to Access Act. And I want to start by thanking the chair and the committee staff for their feedback and collaboration, and I will be accepting the committee amendments. AB 2540 will expand equitable access to medication abortion services for students attending community colleges across California. California has long made access to reproductive health care a core value, and this bill will move us closer to that goal by requiring community colleges that have existing student health centers to provide these services. While similar services already exist at the University of California and the California State University campuses, community college students currently face significant gaps in access to reproductive health care. Reproductive health care is essential health care, and access to this care should never be dependent on the type of college a student attends. It's past time for us to do right by all California students. With the Community College Student Right to Access Act, we are closing a critical gap by ensuring that community college students, one of the most diverse and economically vulnerable populations in our state, have the same access to care as their peers at four-year institutions. This legislation would allow services to be provided specifically on college campuses that have existing healthcare centers via telehealth or through contracted providers. It also improves transparency by requiring colleges to publish information about available services. I'm committed to working with the leadership and administration at the community colleges to address any of their concerns. With me testifying today is Claire Densmore, Legislative Affairs Director at the Student Senate for California Community Colleges, and Dr. Michelle Gomez, a family physician with over 20 years' experience providing primary and abortion care in California.
Thank you so much and welcome.
Good afternoon, Chair and members. My name is Claire Densmore. I'm a student at Sacramento City College and the Legislative Affairs Director for Region 2 of the Student Senate for California Community Colleges. I am here today in strong support of AB 2540. At a time when reproductive health care, including medication abortion, is increasingly uncertain or out of reach for many, it is critical that we strengthen access where we can, especially for students who already face significant barriers. For community college students, access to healthcare isn't just about what exists on paper, it's about what's actually within reach, and too often it isn't. This became real to me through a friend of mine and fellow community college student. She attended a campus where the nearest Planned Parenthood was over 2 hours away. When she experienced an unplanned and unwanted pregnancy, she needed care, but didn't have reliable transportation, was working multiple jobs, and was a full-time student. What should have been a straightforward healthcare decision became overwhelming simply because care was out of reach. That is the gap AB 2540 addresses. This bill expands access to medication abortion at community college health centers and ensures that students are clearly informed about the services available to them. It helps make reproductive health care not just legally available, but practically accessible. Community college students are balancing work, school, and real financial pressures. Leaving campus for care can mean delays or going without care altogether. AB 2540 is more than a bill that just closes this gap. It brings reproductive health care to the forefront of health equity. It centers students by ensuring campuses have accessible, well-supported reproductive health care resources within reach. At its core, this work is about protecting geographically siloed communities by bridging access, supporting students, and ensuring that wherever you go to school does not undermine your right to whole-person health care. Thank you, and I respectfully urge your support for AB 2540.
Thank you so much and welcome.
Good afternoon, Chair Fong and members. My name is Dr. Michelle Gomez, and I'm a family medicine physician who has provided primary care and abortion care in California for over 20 years. I'm also a proud mother of 2 teenagers, including a daughter in her first year of college, so this bill is particularly important to me. My daughter's 2 best friends from high school are both children of immigrants and are attending community colleges in California. They're both like daughters to me, and they deserve access to the same excellent health care as their peers in 4-year colleges. If we truly believe in reproductive freedom, justice, and equity in California, we must pass this bill. Approximately 40% of counties in California lack an abortion provider, so community colleges can be a lifeline. And I understand that the idea of providing medication abortion might feel daunting to people who haven't been active in this work over the last several years, but it's simpler than ever. My tiny primary care practice started offering medication abortions in 2000, 26 years ago, right after mifepristone was approved by the FDA. I was also honored to help Sonoma State University integrate medication abortions after SB 24 and recently helped the UCSF Women's Health Primary Care Clinic to do the same. What has been universally true in my experience is that it feels scary before starting, but afterward, providers come to me and tell me I was right, that it's really not medically or technically difficult at all, and that it's extremely rewarding to help a young person think through their options and, if they decide to end the pregnancy, to either provide them with care directly or give a warm handoff to someone who can help. Routine ultrasounds and routine follow-ups are no longer required based on real data, and if providers have questions, they can call the California state-funded UCSF Reproductive Health Hotline for immediate free help. There are also call services to help patients with questions after hours. The benefit to students is enormous by not having to delay care and interrupt studies because they can get what they need from trusted providers right on campus. I know that everyone working in the community college system is committed to providing the best education and healthcare to their students, and I strongly urge a yes vote on AB 2540. Thank you.
Thank you so much. Are there witnesses of support in the hearing room?
Hello, Alicia Nackbull, Vice President of Legislative Affairs for the Student Center for the CCCs, proud co-sponsor of this bill and in strong support.
Thank you.
I'm Angel Bonilla on behalf of Sacramento City College in strong support. Thank you.
Thank you.
Jason Henderson on behalf of the Faculty Association for California Community Colleges in support.
Thank you.
Hi, Julia. I'm with Access Reproductive Justice, and I support.
Thank you.
Hi, Natalie Stolman with Access Reproductive Justice in support.
Thank you.
Hi, Colette Gears with Access Reproductive Justice in support.
Thank you.
I'm Isabella Vo, a medical student at California University of Science and Medicine, and on behalf of Access Reproductive Justice in support.
Thank you.
Hi, I'm Matilda. I'm a student at Cal State San Marcos who's currently studying criminology, and I am in full support.
Thank you.
I'm Angelica, and I'm also in support of AB 2540.
Thank you.
Hello, I'm Anita. I'm also a criminology justice studies student, also minoring in political science from Cal State San Marcos, and I am in support.
Thank you.
Angela Pontes on behalf of Planned Parenthood Affiliates of California in support.
Thank you.
Good afternoon, chair members. Vincent Rosso with the University of California Student Association here in strong support. Thank you.
Thank you.
Deborah Bautista Zaval on behalf of California Latinas for Reproductive Justice, sponsors and supporters. Also on behalf of California LULAC in support.
Thank you.
Erin Pate with Access Reproductive Justice in support.
Thank you.
Hi, Faith with Unite for Reproductive and Gender Equity, co-sponsors of the bill in support.
Thank you.
Hi, Pia, a UC student in strong support.
Thank you.
Hi, my name is Natalie, and I'm also a UC student, and I support.
Thank you.
Hi, my name is Ariana. I'm a UC biochemist student, and I'm in support.
Thank you.
Hi, my name is CJ. I'm a Cal State LA student, and I'm in support.
Thank you.
Good afternoon. My name is Sonia Goch Avila on behalf of Access Reproductive Justice and strong support.
Thank you.
Hi, Kimberly Robinson with Black Women for Wellness Action Project, also a co-sponsor in strong support.
Thank you.
Good afternoon. I'm Sasha. I work at a reproductive justice organization in California, and I'm in strong support.
Thank you.
Hi, my name is Erica, and I strongly support this bill.
Thank you.
Hello, Clarissa Ramirez with California Latinas for Reproductive Justice. We are a proud co-sponsor and in strong support.
Thank you.
Hello, my name is Mariana. I work for a reproductive justice organization, and I'm a big supporter of this bill.
Thank you.
Hello, Jennifer with Access Reproductive Justice in strong support.
Thank you.
Hello, Tanya with Access Reproductive Justice, and I'm in strong support.
Thank you.
Hi, Sochi with Access Reproductive Justice and proud co-sponsor in full support.
Thank you.
Jennifer Robles with Health Access California in support.
Thank you.
Chair members, Austin Webster with W Strategies on behalf of the California Nurse Midwives Association in support, and also with the Student Center for California Community Colleges to answer technical questions.
Thank you so much.
Move the bill.
All right, we have a motion. Do we have a second? I'll second it. Any questions or comments from colleagues? I'm sorry, we got it back. Yes, are there witnesses in opposition in the hearing room? Apologize, please.
Good afternoon, Chair Fong and members of the committee. My name is Nicole Johnson. Hi, I'm past president 2 terms for the Health Services Association of California Community Colleges, as well as a registered nurse and director within the California Community College system. It's difficult to be here today, I'll be honest, on behalf of our organization, because HSA CCC strongly supports student access to all reproductive health care, including abortion. And we are here in opposition to AB 2540 today, as currently written, due to significant implementation challenges that aren't being addressed. We thank the authors for their recent amendments. Allowing colleges to partner with outside providers is a meaningful improvement that reflects the need to be flexible, whether services are on-site, via telehealth, or through community partnerships. However, none of these models offer a simple solution. On-site provision requires higher scope clinicians, protocols, and follow-up systems many colleges currently lack. I don't know if you all know, but many of our systems we're on a public health model, and we are ran with registered nurses only. Telehealth still demands significant clinical oversight and coordination from campus staff. Outside partnerships, while often most feasible, rely on local provider capacity that varies drastically by region. In practice, colleges are being asked to build and manage multiple care pathways to make this work within their health centers that are already operating at capacity and designed for short-term episodic care on a public health model. Funding is critical. Every delivery model requires staffing, training, administrative support, and without dedicated ongoing resources, colleges will face impossible trade-offs between absorbing these new responsibilities and maintaining existing student services. The legislature should not impose new clinical mandates on health centers that cannot meet their current ones. I urge the committee to amend this bill to include guaranteed reoccurring funding before any compliance deadline is set.
Thank you. Welcome.
Good afternoon, Madam Chair and members. My name is Erin Azevedo. I'm a student at UC Davis, and I'm opposed to AB 2540. I was handing out pregnancy resource brochures on campus this fall, and a woman came up to me and whispered, "I'm so glad you're here. I didn't know this was here when I was younger." And then, gathering herself, said, "And I really wish I did." She then shared her story as a sexual assault survivor and how she felt abortion was the only option available. I'm here to say that this bill is not what the community needs, and it is unnecessary expenditure of funds. For my peers, there's no lack of access or awareness of abortion. It is available on campus, at clinics, via telehealth, and even by mail. Access to abortion is not a concern in the state of California. What should take priority is more affordable family housing, childcare without year-long wait lists, and referrals to medical care and support. I recently wrote a final paper on the resources available to pregnant and parenting students at UC Davis, and notably, my professor, who was a parent during her own PhD program, was unaware of the many rights and supports available to her at that time. If even our faculty does not see that support, then it is clear that there are more pressing gaps in reproductive health care than access to abortion. We should be prioritizing resources that are actually difficult to come by. 1 in 4 women in California receive inadequate prenatal care. At least 56 maternity wards have closed since 2012, half in just the past 3 years. Doctors are handling hundreds of births per year. The average OBGYN age is 51, with most retiring by 59. Some rural counties have no OBGYNs at all. Maternal mortality has doubled, with the highest rates among Black and Native mothers. All this decline in care has happened while abortion has expanded. When we reduce students' needs down to abortion access at the expense of every other kind of care, it is exploitive and reproductive coercion. It is unfair and out of touch with what students actually need to thrive. For these reasons, I respectfully ask for a no vote on AB 2540. Thank you.
Thank you so much. Are there witnesses in opposition in the hearing room?
Hi, my name is Megan Pinnell. I'm currently a community college student at Folsom Lake College, and my mother was also sexually assaulted, which her courage is the reason why I am opposing this bill.
Thank you.
Hi, Leandra Wells with the California Family Council. I was a student who had a pregnancy during my last year of college, and I oppose this bill.
Thank you. If you can just, for everyone going forward, just please state your name, support or opposition, and the bill. Thank you.
Molly Sheehan with the California Catholic Conference, also a graduate of Louis Rios System in opposition. Thank you.
Thank you.
Michelle Barkley, HSA CCC, current president, and oppose unless amended.
Thank you.
Teresa Ulrich, Director of Health Services at Fullerton College, and I'm opposed unless amended.
Thank you.
Matt Newton, and I'm a pastor here locally in Sacramento and have worked with college students for years, and I strongly oppose the bill.
Thank you.
Tyler Rawson, student at Folsom Lake College. I'm a veteran as well, and I'm strongly opposed to this bill.
Thank you. Are there any tweeners in the hearing room?
Hello, Justin Selnick on behalf of the California Community College Chancellor's Office. We don't have an official position, but we have been working with the sponsor and the opposition, and hopefully we can get to a solution that works for everyone as it goes through the legislative and budget process. Thank you.
Thank you so much. Colleagues, any questions or comments? Mr. Marsucci?
Ms. Stephanie, thank you for bringing this bill forward. I think the Health Services Association of the Community Colleges clearly stated that while they support providing abortion access, that they have a number of practical considerations. Could you respond to her concerns?
Yes, definitely. Thank you for the question. And we are committed to continue to working with the opposition to ease any burdens. And I do want to note that this only applies to existing health centers on campus. And Dr. Gomez, I know, has simplified the process at Sonoma State and UCSF. So if I can have Dr. Gomez talk about how she sees addressing the concerns that have been brought up.
Sure, and thank you for your concerns and for wanting to make sure this process works well for everyone. It really has been my experience that we've siloed abortion care for so long in abortion clinics that most of our healthcare provider workforce doesn't know that this is really simple care. And when we make it more accessible to more people, we are providing health care. We're saving lives sometimes in different ways. And I think that in the places where I have worked, it's been surprising to people that a room with 2 chairs, possibly a laptop, maybe a phone is often enough to do the options counseling, and no one knows the population better than the people at your health centers. You've worked with these students. A lot of them are young people who are still learning how to navigate our crazy healthcare system, and they really need that support from you all. So it can be as simple as a chair in a private room, a conversation with options counseling, and if the person does decide to end the pregnancy, sometimes it's a matter of bringing on, if you don't have an RN who could do prescribing right there, you could have access via telehealth. I know at least 20 prescribers who would love to do this work and would probably do it for low cost to just come in, have the visit with the patient, and then the medications could be sent to a local pharmacy or directly to their home. So it can be minimal involvement from the health center itself, if that's helpful.
Thank you so much. Oh, did you want to add?
Yeah, I'll just mention that according to the numbers, I was looking at what the implementation of this was for the CSUs and UCs. and it looked like it was about 4.6 million. And I would argue to say that that number probably significantly underestimates what this will cost within the California community college system, just based on our lower staffing numbers, also higher demand. Many of our students do have barriers to care, right? So our strongest opposition is around being more clear about how we actually implement this. Because as far as I'm aware, even with a chair and a conversation in a room, it still can't be done with a registered nurse only. Or, colleges that partner with, some of our colleges partner to operate with community providers or even community faith-based hospitals. So there's a lot of logistics, as we all are aware there, that maybe we wish weren't there, but they are. So we're not all even operating our health centers with our own employees, but with partnerships within the community in other, hospitals. So just, again, the implementation challenges that still really are going unaddressed is where we have our most significant concerns.
Thank you so much. Someone with Dr. Sharp Collins.
All right. Okay, sorry. I'm a little out of breath. I'm exercising, apparently. Committee to committee.
You're good.
I am in strong support of this bill. And I'm actually kind of feeling some type of way. And so let me try to gather myself for a moment. I want us to be clear about what this debate really is. To me, it is about whether we trust students, especially working class students, first generation students, young women, and whether or not we trust them to make their own healthcare decisions, or whether we are comfortable allowing barriers to make those decisions for them. Our UCs and our CSU campuses, they already provide medication abortion. And I remember when this first started, I was a staffer with now Secretary of State Weber and, just going through that process. And to me, this bill simply says that students at a community college who are often older, more financially strained, and more likely to be balancing work, school, family, they deserve the same standard of care. So not less care, but I'm going to repeat it again, they deserve the same standard of care. And yet, we are hearing opposition that raises concerns about discomfort with expanding access. That hurts. But let's call it what it is. This is an attempt to slow down access to time-sensitive care. Because when care is delayed, denied, or made harder to access, the impact is real and it falls hardest on those with the fewest resources. Then this is not something that is theoretical for me. And I'm saying that because I've served on the board of Planned Parenthood of the Pacific Southwest in San Diego. And having served on that board, I sat there with these issues and I continue to sit with these issues that arise as a former board member, but then, just active community member within San Diego County. I've seen what happens when someone must travel hours as a professor, adjunct professor at a CSU. I've seen how students have traveled hours. They've taken off time from work. They've taken off time from class. They've done the things up under the sun. They scramble to find care before it is too late. I can't tell you the different types of conversations that I've had with different students. So I've seen the stress. I've seen the fear and the very real consequences of the system that makes people jump through hoops for basic health care. So when we say that community colleges should have access to medication abortion at their campus health centers, we are not expanding something that is radical. Okay? Mm-hmm. We are correcting an inequity that should not exist in the first place. And let's also be honest about the broader movement, well, actually the moment we are in. Across the country, reproductive rights are under attack. States are rolling back access, criminalizing care, and sending the message that people cannot be trusted to make decisions about their own body. It's my body, it's my right. California has a responsibility to move in the opposite direction, to lead with clarity, to lead with courage, and with the commitment to access. And to me, this bill does exactly that. To me, it ensures services are not just available, but it's also something that's visible. But at the end of the day, For me, this is about dignity. This is about respect. This is about quality of life, being able to thrive. And it's about autonomy. And it's about whether we are willing to really stand up, especially in the face of loud opposition, and say that students deserve access to full spectrum of healthcare. And that's just period. They deserve access, and we need to make sure that they have that access. So I did not have a question. I had a statement, and my statement is coming from a person who truly understands this process, a person who served on this board, a person who has been responsive to my community, who's been responsive to my students, and who strongly believe that we have to be able to have this information readily available, have it visible, and make sure that we are allowing people to make the decisions that they feel is appropriate to get them where they are. So if I didn't make a decision that I made, I probably would not be sitting here today. So thank you so much for bringing forth this bill. I think I said it before, I wanted to be a co-author. I'm going to say it again. Please consider me as a co-author. And with that, Mr. Chair, I'll turn it back over to you.
Thank you so much, Dr. Sharp-Collins. Seeing any further questions or comments? Seeing none, Senator Stephanie, would you like to close, please?
Thank you. And I want to thank Assemblymember Sharp-Collins for her words. They mean a lot. And, you know, it's fundamentally unfair to provide this access to UC students and CSU students and just not give it the same care to our community college students. And like I said, at Health Committee, they are not second-class students, and they are not second class. They deserve the same access. And as far as any implementation challenges go, we remain committed to working on those with our community colleges. And I am quite confident that we can do it. I want to thank all the students and everyone who came out. And Dr. Gomez, thank you so much. I think this is essential care. And I respectfully ask for an aye vote.
Thank you so much, and thank you so much, Senator Stephanie, for accepting the committee's amendments, and I look forward to supporting your measure today. As you mentioned in your bill, this is what health services can and cannot be provided to our community college students. Please continue working with our committee staff and the various impacted stakeholders as the measure moves forward. And with that, I look forward to supporting the measure today. Mr. Secretary, roll call, please.
File item number 22, AB 2540. The motion is do pass as amended and re-refer to the Committee on Appropriations. Fong?
Aye.
Fong, aye. DeMaio? DeMaio, no. Berner? Macedo? Jackson? Mersucci? Aye. Mersucci, aye. Patel? Ramos? Sharp-Collins? Sharp-Collins, aye. Tangipa?
That measure is 3 votes and 1 no. We'll keep the roll open for additional members to add on. Thank you.
Thank you.
Next up, we'd like to welcome Ms. Laura Gibson,